Welcome to Q&A with Doctors A and J, brought to you by Alterman and Johnson Family Chiropractors.
Hello, everybody. I'm Dr. Franca Alterman with Alterman and Johnson Family Chiropractors. And in today's episode of Q&A with Doctors A and J, I have my friend and colleague, Dr. Cristina Padilla. Hello, Cristina.
Hi, thank you for having me, Dr. Alterman. Hi, everyone.
This is such a pleasure to have you on because I have been thinking about doing this with you for a long time because the way that you practice is so neat and so interesting, and I just want to bring this out so that people can see all the different types of practices that we can have. So first, I want to start by just asking you some questions about your background. I know that you've been in practice for about 6 years, right?
Correct, yes.
Where did you go to school?
I went to school in New York Chiropractic College, which, for those of you who don't know, it's in central New York. That's between Syracuse and Rochester.
And how did you end up in Jacksonville after that?
So I've known Jacksonville since I was a little girl. I have a lot of family here from Puerto Rico. They've relocated here because they were military or just because life brought them here. So I've always liked Jacksonville. I've always been very familiar with the city, and I wanted to be close to family. I actually lived and practiced in Buffalo, New York for a little bit. And then we decided to relocate to Jacksonville in 2015.
Okay, awesome.
Yeah.
So I know that you have a passion for working with moms and babies as well as we do. And because of that, you have also gone to some of the ICPA seminars. Tell us a little bit about the certifications or the courses that you have taken.
Absolutely. So I first came in contact with Jeannie Ohm. Rest in peace. She's been a wonderful person for our community, our Berlin community and chiropractic community. I first came in contact with her Webster Technique course while I was still a student in school in 2012, I believe. It was my second year of chiropractic school. And obviously this was not a course that they offered in school, so I decided I wanted to take it because I've always had a passion for wanting to work with kids and pregnant women. My original thought was that I wanted to be an OBGYN. So so I was like, absolutely, I'm gonna go see what this is all about. I have no idea how chiropractic can be so effective for pregnant women. And of course, she opened my eyes to this whole new world, and I was sold instantly. After like 8 hours in the room with her, I was like, this is it. This is what I'm gonna be doing. So that was my first experience. And then after that, as a student, I instantly started taking all the courses to finish the certification.
Right.
Back then, the certification was a little bit different and a little bit shorter. Since then, fortunately, they've expanded. So I finished my certification last fall. So I am fully trained with the ICPA, and I've gone through all of their courses and the new updated courses they've done. And besides that, I've done a little bit of additional training with craniosacral therapy through other programs outside of the ICPA as well.
For those of us who may not know about the Webster Technique, can you give a little explanation about what it is and when it's used, and why is there such a craze about it all over the birth world?
Absolutely. So the Webster Technique, first of all, is a chiropractic exclusive technique. Dr. Alterman and I practice this way, and Dr. Johnson as well. And this is a chiropractic specific technique developed by a chiropractor with the idea that there needs to be a balance between the pelvis, the sacrum, and the uterus and all the ligaments surrounding the uterus, and that help a woman go through pregnancy and through birth. So it is not just an adjustment, and it's not just something any woman with, or I should say, it's not something that is, it's a specific way of treating a pregnant woman. There is a big difference between low back pain from a woman that is not pregnant or an adult, a regular male, and the difference between a woman that is pregnant and experiencing low back pain. There's a big difference in the reasons why this happens, and the Webster Technique specifically addresses those. So the way it works is that we have a specific protocols and indicators that we, during our exams, we follow, and we look for specific guidelines and setups that let us know as chiropractors what we need to focus on and what adjustments we need to do. There are unfortunately a lot of myths out there, or misconceptions about what the Webster Technique does or is. The Webster Technique is not a baby turning technique. We do not touch babies. We do not turn babies, because that is practicing OBGYN, and we are not OBGYNs. But there is a correlation, and there has been a really high correlation between women who receive the Webster Technique and the fact that as you adjust the pelvis and you are opening up the space within the uterus and the pelvis and the pelvic outlet, then there is more opportunity for a baby to move in the way the baby needs to move. So it's about between 80 and 90% of the cases this happens. So it's very, very important to be part of every woman's prenatal care.
Yeah, that's excellent. I went to chiropractic school at Life University, and I graduated in 1984. And at that time, Dr. Larry Webster was actually the clinic director at our downtown clinic. So I learned the Webster Technique directly from Dr. Webster when he was in our school. And
isn't that amazing?
It was unbelievable to watch him and to see women that would come from all over the country. They would fly to Atlanta to see Dr. Webster because of this misconception, which you could say that, but they would come because their babies were BREECH or their babies were transverse. And after Dr. Webster performed the analysis and the adjustment on them, their pelvis would balance in such a way that it would allow the baby to get into the position that the baby knew they had to be in, but there was something in the way, something blocking the way of the baby, and it was a misalignment in the pelvis and in the balance that you were talking about. So it was a real treat to meet Dr. Webster and seeing him in action.
I know, that's incredible. That would have been amazing.
So besides working with pregnant moms, you also work with babies a lot. And I know that you have a passion for that. Tell us a little bit about why a baby would benefit from chiropractic care, and what kinds of babies should be analyzed and seek chiropractic care.
Absolutely. So I suggest that every baby should get checked out, regardless of what outcome the birth was, whether it was a C-section baby, whether it was an unmedicated vaginal at home versus an unmedicated vaginal at the hospital, whether there was an epidural. I think every baby should be checked out. Birth is a beautiful process, but it can be a very traumatic process for any baby. And just the actions that happen, all the work, if you will, that the baby needs to do to be able, along with the mom, to be able to come out of the birth canal, that is the way that this baby has been birthed. It's a lot of stress on the baby. It's a lot of stress on their body. They're going from a very warm and cozy environment, very dark, very quiet, to a lot of bright lights and a lot of new people and a lot of new experiences, and that can be absorbed in the body in a lot of different ways. I compare it to parents just as when we are stressed out or we're put in a new situation. Some people, when they're very stressed out or they are faced with something new or unexpected, they get anxiety, or they'll get headaches, or some people, like for me, I get like stomach aches. That's my way of responding to stress and anxiety. So this is the same way that a baby will respond to coming out to the world, depending on how well their body is receptive or how well their body is able to accommodate these changes. Some babies adapt very well. Some babies have a little bit more challenge and they need some of that care and evaluation. So the reason why we adjust babies and the reason why we want to check all those babies within the first few weeks or the first few months of life is because these stressors can show as physical stressors, but they can also show up as neurological stressors. And we see it all the time. We see babies with colic, babies that don't sleep well, digestion problems. I see a lot of babies, I want to say 8 out of 10 babies that I see are babies with tongue ties and lip ties. and a lot of cranial deformities because of the trauma they go through birth. This is why I do the craniosacral work, because those babies really need that care after they get their lip and tongue tie revisions. So yeah, I always suggest every baby should be checked out. Some babies don't need to be adjusted as often. Some babies need a little bit more care at the beginning, just to help them get in touch with or get acclimated with those changes in their environment, and so that they can go through their milestones, their developmental milestones, without any issues.
I know that a lot of people are probably thinking, I've seen chiropractors adjust spines in adults, and I would never want my baby to go through that. So talk to these people about what it's like to adjust the baby and how that is so different from the way that an adult would be adjusted.
Absolutely. Oh my gosh, that I'm sure you get this question all the time. It's like, oh, you're gonna crack my baby, and we don't do any cracking. We don't crack adults. We don't crack babies. But yeah, so it is chiropractic for infants, especially, and for any baby under the age of probably 3 years old. It's very gentle, very focused and specific. It looks, in a general, from an outside perspective, it probably looks like a little bit of tiny compressions and steady holds and almost like a massage type of adjustment. So it's very gentle, gentle care and very gentle adjustments.
So just to show people, I have one of the instruments that we use to adjust babies, and I'm sure Dr. Padilla also has one of these. It's called an activator, and it is an instrument that delivers pressure through this very soft rubber tip. And it is almost as if you had a tiny little hammer and you could hammer the bones back into place. And the way that it works is it delivers the pressure just like that. And by moving this ring, you can actually make it have more or less pressure. For a newborn or an infant, we would bring it to the very, very lowest setting. And as you make the adjustment, the amount of pressure that comes out of here is equivalent to if you were testing the ripeness of a tomato. So that amount of pressure is what a baby would feel from having an adjustment with an activator. And
absolutely.
This is a really important thing for people to know, and I'm sure that Dr. Padilla, as well as all the chiropractors who work on babies, this is one of the first things that we explain to our patients, how gentle and how easy an adjustment is on a baby, whether it's done by our fingertips with just pressure or with an instrument like this.
That's exactly what I tell them. I tell them, put your finger on your eyelid and push a little bit in. That's about the same pressure I'm using on a baby to do an adjustment. And they're like, oh, okay. Yeah, it's very easy. I have a video I wanted to show of me working on a baby. This is an 11-week-old baby that I saw earlier today. And she was born very quickly. So she had a little bit of cranial deformities, and that was connected to some tongue ties and lip ties. And I know this is something you see in practice quite a bit as well. I think it's something we're seeing very frequently now for multiple different reasons that we could talk about that for hours, I'm sure. But it's probably the most common thing that I see patients for. So this video shows a quick clip of what an assessment and an adjustment looks like for this baby.
Okay, so we're gonna put that on right now, and we'll come back on the other end. We're back after that great video that shows how a baby can be assessed and adjusted by a chiropractor who specializes in babies. And now I want to talk to Dr. Padilla about her very out-of-the-box and unusual type of practice. And I think that you call it a mobile chiropractic, right?
Yeah, yes. Technically, a mobile house call, I don't have I guess there's a little bit of a difference. Most mobile chiropractors have an actual unit, but the term is generally the same. So I am a house call chiropractor, which means I bring my services to the patients at home. The majority of people I see at home, I do see some adults and professionals in their offices or at their business. I think the most unique place I've adjusted a business professional was at a restaurant. So that was pretty fun. But yes, so I do mobile work or house calls, and that has been an amazing opportunity for me to bring services to people who otherwise wouldn't be able to. Obviously, the majority of my practice, like you were mentioning earlier, is kids and pregnant women, because that's my big passion. But these mobile services are really, really convenient to people who are in the medical field, who have like nurses, for example, who have these crazy hours, or doctors, or like business professionals. Mm-hmm. I'm sure you have you've been in this situation before, where we're working all day. So by the time we get out of work, nothing's open. So we don't have time to get our own appointments in sometimes. So this kind of helps manage that. I see a lot of families as well that don't have the ability to get out as easily with the whole family to go to a doctor's appointment and drive somewhere, sit there and wait and be seen and all of that. So this eliminates a lot. That is kind of why I started it. I wanted to have my own practice, and I was at a point where I wasn't sure. I didn't want to have to take on too much too soon. So I had been thinking about this because a lot of the families that I would see, one of the big issues was that they wouldn't be able to make it into the office all the time because one of the kids had some responsibilities, or one of the parents couldn't make it. So sometimes there was always someone missing that needed that regular care and wasn't getting it. Yeah. So this was just a really good way to be able to provide that to families in the area. I travel all through Northeast Florida. So I've traveled today. I went to McLeany, which for people who are watching that are.
Okay. So after a few technical difficulties and a change of scenery, we're back with Dr. Padilla. You were telling us that today you had traveled to McLeany, and you were making reference to the fact that you traveled to different areas of Northeast Florida.
Yes, so it's one of those benefits with the house calls and the mobile business. For example, today I went out to, like you said, to McLeany, and for reference, for those who are not from Northeast Florida, that's about 40-45 minutes away from Jacksonville. So this is one of those situations where that family probably wouldn't get that care. Because it would become a little bit of an inconvenience for them to have to travel all the way into Jacksonville for some specific care. So that is kind of one of the main things that I try to provide, and one of the main purposes of the practice is just to make it convenient so that chiropractic can be something more accessible to people. I think, and I know you agree, you probably agree with this, that we should be more mainstream and consider more of a, primary source of care as well. And I know that's the type of practice you and Dr. Johnson try to promote as well. So
yeah. I think that one of the things that people probably have questions about with the type of practice that you have is, how can you have everything available in your car? What is it that you have that you travel with?
I know, I usually get the question like, do you have like a van? And I'm like, no, I just have my trunk full of stuff. So I bring, obviously there are some limitations. For example, you have in your office some tables that have some specific gadgets, if you will, but some specific drops and techniques and things like that some of the portable tables don't have, at least the ones I do. But in substitution for that, I have some other hands-on or portable instruments that I can use that resemble those same type of practices or adjustments that you would get at a normal chiropractic setting or a normal chiropractic office. So yes, I have a backpack with some of my tools, and I actually have a video to show you that shows you what my trunk looks like on a regular basis. So it's a little clip that shows all my equipment, and I kind of explain how that goes. So yeah, I hope you enjoy that. It answers a lot of questions, I think.
Okay, so we're going to look at that video right now for the benefit of those who ask the question, how can you be a traveling chiropractor? Here you go.
All right, everyone, I wanted to show you a little bit of what it looks like to do a house call, especially for a pregnant woman or kids, newborns. This is the majority of my practice. So as you can see, this is the trunk of my car. This is what my trunk looks like almost every single day. So we have the table down here. It's a portable table, so as you can see, it folds, and this one is a pretty simple table in the sense that it doesn't have any of the specific gadgets you may find in an office. However, there are other tables that do have those special gadgets that are available. Because I don't have those, I have some other tools I use. So this here, it's a little, almost like a drop. If you've been to a chiropractor before, you've seen this. This one is obviously for kids, or to adjust knees, ankles, wrist, toes, feet, different things like that. I mostly use it to adjust kids, toddlers and infants, to adjust their necks. Sometimes to pregnant women, if they can't lay a certain way, I'll use this to adjust their hips and their pelvis. These are called SOT blocks. SOT is a specific technique that focuses on the sacrum, the pelvis, and the cranial and upper cervical. So these are used to adjust the pelvis in a more gentle way. Again, very safe in pregnancy as well. That's the pregnancy pillow. It has a hole in the middle so that the belly fits there and the mom can lay on her stomach to get adjusted and get her spine checked out. That's my bag where I keep most of my tools. Yes, it is a diaper bag. I get that question asked at least 3 times a week, and yes, it is a diaper bag, but it has a computer sleeve in it, so technically it's a professional bag. I use rock tape. This is something that not a lot of chiropractors tend to do. I do a little bit more rehab and muscle work in my practice, so I use rock tape to tape pregnant women instead of having them use belly bands and different things like that. So really fun stuff to use. It works very well for late pregnancy. And this is an activator, another technique to use with chiropractic, and it's very specific as well. This works great with kids and with pregnant women who can't tolerate the manual adjusting for multiple different reasons. I currently have a patient that has scoliosis, and she's fused in her mid-back and lumbar area, so this is a great way to get her adjusted. So
here we are after that great video, and we are about to wrap this up, but before we do that, Dr. Padilla, are there any last-minute comments that you would like to make?
Well, I wanted to first thank you for having me, and thank you and Dr. Johnson for having me. I know the 3 of us have that same type of mentality, and the 3 of us want to support the birthing community. I think it's something we hold pretty tied to our mission and to our practice, and I think it's really important to bring that message across, not only for the birthing community, but just in general to the health community, to educate about the type of services we offer and how we can be a resource to the birthing community and to women out there, and even to the traditional, so to speak, medical community in regards to OBGYN care. I know we're very supported here in Jacksonville by the OBs and the midwives working in hospitals, and that is amazing for our community here in Northeast Florida. But I would personally like to see that extended to all other areas of not only the state, but in the country, because there's such a need for that support outside of the hospital setting and outside of the OB offices.
It's true. And we do have a great birthing community here. We have great midwives, great doulas, childbirth educators, pregnancy chiropractors, pelvic floor specialists, physical therapists. So we are lucky to be very, very well supported in that type of community. Well, Dr. Padilla, thank you so much for taking the time. And I know that this will be a great interview for those people that had no idea that a pregnant woman could be adjusted, and that a pregnant woman could be adjusted in her own home by a traveling chiropractor, and that it is so beneficial for pregnant women to have chiropractic care, because it gives them a much easier pregnancy, more comfortable pregnancy, healthier pregnancy, but more important than anything, it helps these babies to come out easily. So by practicing good pregnancy chiropractic, we are actually saving babies from having trauma during their birth and from having to then go to a chiropractor that's going to need to fix them from the trauma that they had during birth. So our ulterior motive for seeing pregnant women is saving babies.
Yes. Thank you so much for having me. It's always great to see you and to talk to you.
All right. Bye-bye. And we will see you very
Bye.
soon.
Yes, thank you.
Thank you.